piece we're going to talk about is about measuring our well-being, and we're going to look at the indicators. So on that Venn diagram, we had the three overlapping circles. One was looking at ethics, one was looking at identity, and the other one was looking at indicators. And so I shared with you some work earlier about indicators existing at different levels. Sandra's presented to us indicators that relate to one particular nation's vision of well-being for themselves. Some of those indicators might be applicable to the other communities. Some of them may not be. Going through the process as a nation of defining what you want to measure for yourself is building community. It's building community well-being in itself. Just the process is. When people can come together and talk about what well-being is and agree that that's what they want, that in itself is moving towards well-being. So in a transformative change accord that was signed 10 years ago, 10 years already, they committed to doing a bunch of stuff under 4 headings, basically. So the governance and relationships piece, we're working on that one. We're doing more of that work in governance because we recognize we've got to get higher than just the health stuff when we're talking governance. We're also looking at health promotion and disease and injury prevention. I asked Mark, when we were looking at the diagram that Jeff presented, and he was showing in the UK, all of those things that leading to death. I asked Mark, is it still injuries high on our list in Indigenous communities? Injuries are still up there? And he said, yeah, they're still high up there with respect to our deaths by disease. No, injury is still big up there. Health services and then performance tracking. So they're all intertwined because if you're going to track performance, you track performance at different levels. You track system performance, but you also track the performance, what's happening because of the system. And I talked about the outcomes and outputs kind of a thing before. Problem is, we've had the federal government trying to track the outcomes at the community level and forgetting about their own system and the brokenness of the system. So they keep relabeling things. If you've been around Indian country, working in our communities more than 10 years, you've seen a program go, as he's smiling right there, you've seen a program go by you probably 4 or 5 times with different labels on it. Eh? We're still trying to get people from welfare to work, another label, another label, another label. Getting behind that to know why aren't people getting to work. That's what we really want to know about here, not a program, but we need to know about what is actually happening in our community. Why are people not employed? Well, I talked about my own community having a very high incidence of fetal alcohol affected people. If they're just going to go downtown, they're not going to get a job. We've got to do something differently. So we've got to create the environment for them. So performance tracking, both of the machinery, but also the results of the machine, both have to happen. And so Harmony Johnson inside the First Nations Health Authority, working with this team that she has here that are doing these data governance forums, she's now working to put together the tripartite evaluation framework. How are we going to measure things? Because as I say, we inherited some measurements around morbidity and mortality, et cetera. We didn't even have good measurements in place to look at our own machinery. So we're wanting to look at measurement at the provincial level, or actually at the tripartite level, which involves a national government as well as a provincial government, at the regional level as well as at the community and nation level. So when we know about evaluation, we got a lot of work to do. Some of you have seen this image before, I'm sure. There was a report produced not that long ago, growing up in BC. It's, I think, every 5 years we produce that report, is it? Perry Kendall and Company? Something like that, I think. Something like that, 4 or 5 years or so. Anyway, if you've seen the data behind here, you'll know that the trends for the young people in our province are not that good either. So the trends for general health care and healthiness of Canadians is not so good. And when you look at growing up in BC, they still suggest that there's some things we could do to make it better. This statement here is one that I think we should all get branded on t-shirts and maybe hand to every person who's elected to understand that this is what we're talking about, people, right? We should make sure that our children are safe, they're secure, they have everything that they basically need, including a sense of belonging and being loved. That is critical, critical. And as I say earlier, they took basically all of our mechanics away, our structures, on how we created the concept of belonging, on how we knew about being loved, et cetera, et cetera, et cetera. I have a song in a line in one of the songs that I've written. It says, boys without fathers don't grow up to be men. Girls without fathers go looking for them. And so we recognize again in our construct of our family, it's been torn apart so badly that our young people don't have the modeling that they need to actually become the strong, healthy person that they could be. So how do we create those kinds of structures again so that people can have access to those things. We had customs adoption. We knew how critical it was for a family or a child, parents to have a child, that concept of wealth again. So my grandmother was actually given to her auntie. She was given to the family to raise because they had no children. And there was many children over here. And it wasn't a bad thing to be given to that other family. It was actually an honor to be given to that other family. You were like, hey, I was the chosen one, hey. So the sense of love and belonging, they didn't feel like they weren't loved or belonged. They actually felt double loved, double belonging, because I've now got two places to be. So how our values overlay on these things, again, is very, very important to the work we do. Investigate on the strengths of the home. We don't go in with the deficit sheet in front of us like the ministry people do. We don't go in and go, dirty dishes, oh no, food on the counter. Oh. You come to my house, you're going to see dirty dishes and food on the counter, okay? You're going to see all kinds of the things going on that would basically say my kids needed to be apprehended. But they're not coming looking at my house. Why, right? So how can we make sure that our people in our communities are all strong, safe, and supported? Well, guess what? I talked about that genetic thing earlier in the swimmer. Well, you know when a cell divides, it goes into two, and then the two split into four, and then the four split into, and then it just keeps going exponentially. Well, that's the same way our genetic background works, our history, our family history works. You start off with a mother and father, but you immediately end up with 4 more people around you, and then you end up with 8 more around you with having great-grandparents around you. So when you understand that we were actually nested in the social support network we needed to thrive, and that we had all of these other relationships around us that helped us, we got to go back to understanding what the roles were that were embedded in those functions. Okay? Form follows function, generally what the concept is. What did our aunties do for us? What did our grandparents do for us? I was having a conversation at lunchtime. We had a grandmother in a room where the granddaughter or the daughter-in-law was giving birth in the hospital, and the nurse said something to the mother about the cord blood, and the mother didn't have a clue. She's a fetal alcohol-affected child. The nurse, the grandmother was going to say, hey, we want to deal with this, and the nurse basically told her, no, you don't have nothing to do. This is not yours. This is the mother's choice, not yours. They don't understand how important the grandmothers are in our culture. In fact, grandmothers are the lawmakers in my ways of going. So it's like, again, how do we make sure that we're instilling upon people that, no, the grandmother needs to be in the room, in fact. It should be criteria that they have to be in the room and be involved in not that they get invited in if it's okay. So when we think about indicators again for us, we got to think in terms of what are we trying to measure and where do we have opportunity to do some of these measurements. This is a picture of a school back home, one of the classrooms. And when we think about the kids in that classroom, we're thinking education. Well, no, actually early child development, before I get to that school, if I haven't had early child development experience, they're going to have a different situation when I get there, okay? I missed over 70 days of school in grade 1 and 2. Over 70, okay? There's only 190 teachable days. You know why? Because when I went to school, they told me to sit down and shut up, Gwen. You know Gwen. You know Gwen right now. Didn't work. I'd rather stay at home by myself than go there and be told to sit down and shut up, because I had no purpose. What was I there for? I already knew how to read and write, basically, because I had all these older siblings teaching me stuff. So what could I offer to that classroom? Grade 3, teacher got me. I had my remedial reading group. I had my charts to do. I had like social responsibility. I was there. I had meaning. I had purpose. I had a sense of belonging. The other kids that needed me, I was there to help them so the teacher could actually get on with the other things that she needed to do. So when we think about this classroom, that's where we should all be focusing. Education is the institution we've got to fix. I said to somebody at lunchtime, health and child and family are like the pooper scooper ministries, and education's like the pony in the parade. Lots of money coming to them, but then we got to go and fix the things that come out the other end because they're broken. Their spirits are broken, their minds are broken, half the times their bodies are broken. So it's like, we got to fix this. We got to take control of the education system because that's where you build human beings, right? So we can invest in these systems to do differently. Because right now we're kind of in this funky place where we got all kinds of money that's going into taking care of all of these other things and not enough taking care of the things that can take care of us, like our culture and our values and our families. We want to shift this around so that we spend more money on the prevention side of the equation, so that the other side, phew, lighten the load over there, please. We don't have enough money. If we actually looked at the trajectories we're on, we don't have enough money to take care of us as old people. So we better do something about it here pretty quick. So again, this is not any rocket science, this is not something new, this is something that people have known for a long time. It's just how do we go about implementing it. The closer you get, the smaller the body, the easier it is to actually implement. When you think of something like population health, it's hard for the Canadian to do the whole, Canada to do this. They're so focused in on taking care of the daily machine. They're so focused in on the economy that they forget that there's people in the economy. And so we have a job to do as Indigenous people, not only to help repair our own institutions, but to help the other societies with their institutions too, because they don't even realize how broken they are. So appreciative inquiry, as I said, it's a very important thing. We want to know what are the strengths of the community? What are the strengths of the people that are inside the community? What opportunities exist for the community, etc. We want to try differently, not harder. So we want to think differently, we want to measure some different things in community. So when we think about wellness indicators, they've got to be that, wellness indicators, not sickness indicators. So I talked before about those ones that we had given to us, the morbidity, the mortality. We want to change those. So we're going to start changing those. We're going to start labeling the youth suicide to youth vibrancy. Initially, we'll still have to use the same data that's available because we don't have the data that describes what a vibrant youth is until you tell us what it is. You tell us what a vibrant youth is, and then we'll find the data to actually attach to that concept and report on it. But without the picture of what that means, we can attach all kinds of stuff to it, and it might not be the right picture. Like Sandra said, we got to go and ask, is this right? And when they tell us yes, then we know. And that's what FNHA is doing here, asking, what is it you want us to measure? How do we want to measure it? How do we want to report back to our people? Because you know what, we've got the solutions together. And high-level thinkers say it's worth it to do this. You got to do it, people. Because you know what, the cost of doing the research does not far outweigh the benefits. Is that earlier one? It's flipping that thing around that Jeff had there this morning about, no, we're not going to invest in research for the Indians because there's no benefit to it. No, we are going to, because we know there's a significant benefit to it. And so there's a website address for the BC First Nations Data Governance Initiative. That's the work I'm doing in setting up doing data governance from the nation level. So on that website, you'll find all kinds of different tools and instruments, et cetera, the work we did last year, the work we're doing this year, and the work we're going to be doing moving forward. And it'll identify some of the partnerships we have with the demonstration site communities, et cetera, because we're all going through this process. And that guide, that measuring wellness guide, that was developed by these communities working together last year. So it's a reflective guide written for communities, by communities. What are you going to measure? So it helps us to think about what we're going to measure. We're also got the reporting and planning standards, and we're doing a reporting template this year to look at the data sources that you can access to actually provide a report to your communities. We got an exercise going on, what's data that they might want, what's data that we might want, and is there even any common data? Because a lot of times the data that they want, we don't even want. So giving it back to us, that's not a gift, that's baggage. So here we say this is the concept of moving from sickness to wellness, just how we want to start the labeling. And we're going to have an exercise now, a facilitated exercise. Rebecca Lee is our indicators expert inside the First Nations Health Authority. And Rebecca's been leading, this will be the fifth of the sessions now. We've gone through a similar exercise in each of the other regions. You're going to have tabletop dialogue. You're going to get to talk to each other. You're going to do some writing. This is, you've relaxed enough. This is where the hard work starts. So thank you for listening to me and Rebecca Lee, and take it away.
My name is Rebecca Lee, and I'm the Wellness Outcomes Evaluation Specialist with RT, with the First Nations Health Authority. And I've been working with the First Nations Health Authority since June 2015. I want to take this time to acknowledge the territory that we're on, and for all of you that have traveled from the northern region to join us here today. In this session, I will be building on Gwen's always exciting and passionate presentation. So Gwen has already set the stage around connecting the I, being the individual, and the we, being the community, and the them, the other groups and partners, in terms of wellness indicators. Specifically, I will be presenting and asking for your guidance on the FNHA wellness indicators at the provincial level. As a representative of the FNHA, your health authority, I'm here to listen and to better work with you and your community to improve the healthcare piece of the pie. I look forward to learning and sharing with everyone on this important topic. So what we've heard from you in the northern region is that it's necessary to identify meaningful, measurable indicators for wellness that describe a well person and a well community, using community-driven and nation-based terms. The importance of collecting data on the social determinants of health and the environment, and that data to provide a complete picture of community health. More broadly, from the fall regional 2015 caucuses, we heard from participants from across the region that physical and mental wellness are the most important domains of health to focus on for First Nations communities. The FNHA has been working on wellness indicators in different formats for some time, within the FNHA and with First Nations communities. To date, a number of steps have occurred in the development of wellness indicators, including conducting a literature review, engagement through surveys, and last year at the Vancouver Island Wellness Forum and the Gathering Wisdom, where the concept of wellness indicators were introduced to communities. We also heard from feedback from participants through the regional caucuses, regional strategies, and action plans. A word cloud was created capturing key themes on the topic of wellness indicators. Words represent the number of times that words were used. As you can see, words like health, wellness, community, and information are key themes. Also, data, indicators, and outcome-based are also repeated strong themes. All of these words strongly link to the exercise we will be doing on wellness indicators. FNHA is working with Gwen in supporting community indicators to help set a bar for the measurement of health outcomes, to highlight and to share what's going well in First Nations communities. How do we, the individual, the community, and the FNHA, reframe the discussion away from disease, deficit measurements, into highlighting wellness successes among First Nations in BC? Some of the questions we hope to address: what do strengths-based wellness measurements for First Nations look like? What gaps will wellness indicators address in the measurement for First Nations health outcomes? As I've already mentioned, wellness indicators has evolved in many different directions to make sure that FNHA is going in the right direction and is measuring the right thing. In the last 6 months, a consultative process by internal FNHA staff has taken place, and now through these regional data governance sessions with some community members like yourself. These indicators are only draft indicators, and we are looking for your feedback and to decide if these are the right type of indicators. FNHA is working to develop approximately 4 to 5 overarching global indicators. The community type indicators are those developed by community and are separate. For this exercise, we included examples of community type indicators which will feed into global indicators. However, I'm certain that you have many better examples which you can share with your tables today. In terms of actually collecting data on wellness indicators, some of the wellness indicator questions are already being collected through the Regional Health Survey. The Regional Health Survey, which many of you have already know about, is a strong tool for collecting data. The RHS in British Columbia has expanded from 65 to 165 communities. Wellness-based questions included in the RHS will better inform wellness indicators for targeted data. Themes in the RHS include examples on traditional medicine, health benefits, social support, community safety, just to name a few. Let me provide you with a couple of examples of the type of questions which are being collected in the RHS. In the area of balance, question 18, for example, asks, what things help make you healthy? That is, physically, emotionally, mentally, and spiritually healthy. For language, do you have any knowledge of First Nations language, if only a few words? For community strengths, what are the main strengths in your community? For access to care, during the past 12 months, Did you require any help, e.g. from a doctor, nurse, or other health professionals? And social support? People sometimes look to different or other companionship, assistance, or guidance for other types of support. Could you tell us how often each of the following kinds of supports is available to you? So how many people before today have seen this diagram on this perspective of health and wellness? Can you put up your hands? Okay. So for those of you who don't know, this is the First Nations perspective on health and wellness. This diagram aims to visually depict and describe the First Nations Health Authority's vision of healthy, self-determining, and vibrant BC First Nations families and communities. This visual depiction of the perspective on health and wellness is a tool developed by the First Nations Health Authority and First Nations communities. It aims to create a shared understanding of a holistic vision of health. This image is just a snapshot of a fluid concept of wellness. It can be adapted and is not confined to remain the same. It's also important, as Gwen pointed out, that the colors all bleed together, demonstrating the interconnectedness of all the areas. So what is the perspective of health and wellness, and how do the circles break down? The center of the circle, which is the yellowy color, represents the individual human being. Wellness starts with the individual taking responsibility for our own health and wellness. The second circle, the orange, illustrates the importance of mental, emotional, spiritual, and physical facets of healthy, well, and balanced life. The third, sort of orangey red, represents the overarching values that support and uphold wellness: respect, wisdom, responsibility, and relationship. The fourth, the green, shows the people that surround us and the places from which we come. Nations, families, community, and land are all critical components of our healthy experience as human beings. The fifth, the blue, demonstrates the social, cultural, economic, and environmental determinants of health and well-being. So as the perspective of health and wellness represents the vision for FNHA, FNHA's vision of healthy, self-determined, and vibrant BC First Nations children, families, and communities, it makes sense to link our indicators to the 5 circles represented in the diagram. Let me show you some examples of what it looks like to apply the 5 rings of the circles to examples of individual indicators. Starting with the center of the circle, which represents the individual human being. Wellness starts with the individual taking responsibility for our own health and wellness. So an example of an indicator at the individual level looks like, I am guiding my own wellness journey. Moving to the second circle, which illustrates the importance of mental, emotional, and physical facets of health, well, and balanced life. An example of an individual indicator could be, I have balance in my life: mental, physical, spiritual, and emotional. The third represents the overarching values that support and uphold wellness: respect, wisdom, responsibility of individuals. So the individual indicator could be, I am connected to culture. The fourth depicts the people that surround us. The places in which we come, the family, the lands are critical. An example of a community indicator, I feel supported by my family, friends, and community. The fifth, on the perspective of health and wellness, depicts social, cultural, and economic and environmental determinants of health and well-being. This is a cross-cutting theme that impacts all global outcomes. This is the area which also includes working with our partners on addressing areas around the social determinants. Once again, FNHA is looking at the health aspect of the social determinants of health. So just to review, this is again the individual level of indicators. The global indicators, which are more specific indicators, will feed into what these indicators look like at the individual level. So here, what are some examples of global indicators? So I am guiding my own wellness journey. An example could be that I have the skills to deal with life stressors. I have balance in my life. The example could be, I have access to affordable food. I'm connected to culture. I feel connected to cultural teachings and practices. I feel supported by my family, friends, and community. An example could be, I have a fulfilling role in my community that brings me joy and pride. Okay, now it's time for everybody else to get to work now. So what we're going to do is to make sure that everybody understands what we're trying to do is I'm going to read all the examples once again, and then at your tables, there's sticky notes on your tables, and so you're going to work with your facilitator to come up with some examples which are meaningful for you as an individual in what you see. And we're going to start with, I am guiding my own wellness journey. So take 5-10 minutes just to start on this one. So at the community level, we are looking at how community can support your health and well-being. Community is represented by we. So we are supporting our community members in their own wellness journey. We are supporting community members in finding balance in their lives, the mental, physical, spiritual, and emotional. And we are connecting community members to their culture. We are providing support to members by working with our community, individuals, family, and friends. What are some of the examples at the community level? So we are supporting our community members in their wellness journey. For example, we are providing transportation services to health centers. We are supporting community members in finding balance in their lives, the mental, physical, and emotional. For example, we are offering fitness classes in the community. We are connecting communities to their culture. We are offering drum making sessions. And we are providing support to members for communities working with our community, family, and friends. For example, we have elders working with mental health programs. So again, we're going to put it back to you, and again, to start looking at the community level of indicators. What do you want from your community to be offering around health and wellness? The last round here, so hopefully the individual and community level have gotten you warmed up. The final exercise is the most important in terms of the FNHA business needs. There are indicators which we need to feed back on to help develop as global indicators. Here are some examples of global indicators which the community and individual indicators will feed into. So FNHA is supporting individuals in their wellness journey. FNHA is providing programs to support balance, mental, physical, spiritual, and emotional. FNHA is supporting First Nations culture. FNHA is providing programs to support family and friends and communities. And FNHA is collaborating with partners around the social determinants of health of First Nations. So the FNHA is supporting individuals in their wellness journey. The example is that FNHA is administering health benefits. The FNHA is providing programs to support balance, mental, physical, spiritual, and emotional. FNHA is supporting respecting tobacco and the first responders program. The FNHA is supporting First Nations culture. FNHA is working with care providers to provide culturally competent care. And the FNHA is providing programs to support family, friends, and community. The FNHA is engaged in community members on getting feedback on a proposal for the cancer strategy. Your facilitator should also have some sticky dots. And so the last exercise that we're hoping is for each of the 4 indicators, which are the FNHA level indicators, we want you to vote, so 1 sticky dot per sticky, as to which idea, theme, indicator that you think captures the best idea that you want us, as the First Nations Health Authority, to take back and sort of to look at. Of course, we're looking at all this information, but just the one that you think is most important.
So as Rebecca mentioned, we'll be using all of this information. Obviously, we have a specific business need. We need to work towards our FNHA indicators, and we'll be taking the comments and priorities that have been provided from you, as well as the other 5 sessions, to start establishing that. And then we'll, continue on with the discussion until we really hammer down what that's going to look like. But I think it's also interesting for you to, as Gwen has initiated, to take some of this insight and sort of self-reflection back to your communities and talk about how can we apply this sort of thinking to the planning we're doing at home. So, some of the things we were looking at in terms of the wellness journey, pride and self-confidence, availability of services, guiding my own decision making, the ability to make choice is a very strong indicator of a wellness journey. When we talk about balance, having time to reflect, speaking with the creator, having a connection, sharing knowledge, the connection to culture, use of traditional names, language, drumming, singing, some of the things we actually saw this morning, connection to family and friends, doing things as a collective, volunteer with the youth ball team, do coaching, have a family support system, reach out to others, enjoy getting together. Plan those times that you can be amongst your friends and family. So these personal things I think are all important. And when it comes to the community level, we can take a bit of a look at the collective, share practices with other First Nations. So seeing what has been done in other communities, like we see on the wall on the other side, and looking at how can we apply that to our reality. Share cultural resources, have healing ceremonies, support elders, and keep finding ways to have them involved in the community. And when it comes to balance in the community, having cultural camps, food and nutrition classes, different types of workshops, women's exercise clubs, how to keep people moving, connecting community members with their culture, some of the same things, languages in schools, have it be a programmed part of the thing you do in your community. Teas and medicines, singing, family nights, calendar sessions, acknowledging the things that you do in a community on a yearly cycle. Do you have hunting events? Do you have berry picking events? Do you have fishing events? Providing to support to members of the community, family, and friends. Lots of stuff on here. Succession planning. That's a very interesting one. We're into that in our community. Our band administrator is into his final years working for us, and we're looking around wondering, who's going to take that role next? He's done it for 35 years. Does anyone else even know how to do it? So, what do we do next now that he's stepping down? Elders' luncheons. Keep those groups meeting. Baby welcoming ceremonies. Bring communities in for planning sessions. Investing in children. So all these are things that are important at the First Nations community level and at your personal level. And then you're providing us guidance as the First Nations Health Authority, as your First Nations Health Organization. And some of these, much as the conversation Sandra talked about earlier, aren't indicators onto themselves, but there's things you want us to do, which is good. And maybe we can flip that wording into more of an indicator language a little bit farther down the road, but at least we're getting the appropriate direction in terms of what you'd like to see us accomplish. So some of the sort of more popular things up here, looking at patient travel, not a shock to see patient travel. Education on prescription drugs, looking at alternative medicines, outreach services, alternate therapies. How do we be more inclusive of cultural knowledge and teachings in our health and wellness services? When it comes to balance, supporting health and wellness services from the start with children, support staff training, balance approaches, social, mental, spiritual, emotional, educate non-Aboriginal communities, sharing best practices, using traditional medicines, When it comes to culture, engaging with staff members related and having them with traditional wellness plans. Support cultural camps. Focus on ensuring culturally appropriate care. First Nations cultural competency programming. Partner with communities on culture and language programming. When it comes to providing programs to support family, friends, and community, survey community to help fill the gaps. Kind of why we're here for this whole presentation is, do we have enough or the right information to be making service interventions? More work on cultural protocols. Pay for practicums. Provide sessions that the community has told us to have. That's the ultimate in community driven. Be respectful and reactive to what community has asked us to do. So I think there's a lot of good work here, and the team here is committed to taking all of this down again and rolling it into a report in the next 5 or 6 weeks that we'll be delivering back out and providing to you all to ensure that we've heard you appropriately.
We're talking about indicators as far as things coming out of the system, what's going to change for people, and we're talking about, that's really about people and community. We need to do that in community. The grassroots people need to do that. Bang on. The grassroots people have got to inform us, what is a healthy person? What is a healthy Tunacha? What is a healthy Tsimshan? What is a healthy Giksan, etc.? Because our cultural bases are so different. But at the same time, as she was saying, we got to look at institutional measurements too. We got to look at measurements inside the machine, health director level measurements, etc. So that's part of what's going to happen here in the exercise. This is like a splat everything up on the wall, and then there'll be a sort. What belongs for an institutional measurement, what's a community-based measurement, et cetera. So thank you so much for bringing that out. So this kind of feedback, it seems like abstract right now, but what it's going to help to do is to transform those policies to better reflect the realities of the community and the experience of the grassroots. So thank you everybody for the wonderful input.